Are you interested in how all the Medicare supplement plans like A, F, G, N, and the others came to be? Well, in this video, we're diving into a brief history of Medigap plans, how they started, why they were created, and how they've changed over time. So let's get into it. In the late 80s, Medicare supplement insurance policies were kind of a mess. There were so many different policies with confusing terms and benefits, and no standardization between them, it made shopping for coverage nearly impossible. So, in 1990, Congress passed a law, part of the Omnibus Budget Reconciliation Act, tasking the National Association of Insurance Commissioners, or the NAIC, with cleaning it all up. The NAIC developed 10 standardized Medigap plans labeled A through J. The goal was to make policies easier to understand and compare by standardizing benefits, simplifying terminology, and eliminating confusing policy language. Plan A was the most basic. It included core benefits only. From there, each letter added more coverage. These letter designations, A to J, couldn't be changed by insurers, although companies could add naming and brand alongside of them. Later in 1997, the Balanced Budget Act introduced high deductible versions of plans F and J. These gave people lower premiums but required them to pay more out of pocket before the benefits kicked in. Then came the Medicare Modernization Act of 2003. It introduced Medicare Part D, the prescription drug benefit. Because of that, Medigap plans that included drug coverage like H, I, and J were phased out starting January 1st of 2006. New Medigap policies couldn't include prescription drug coverage anymore. But here's the twist. If you already had one of those plans, you could keep it unless you signed up for Medicare Part D. In that case, your drug coverage had to be removed from your Medigap plan and your premium adjusted. With the loss of drug coverage in Medigap, NAIC introduced two new plans, Plan K and Plan L. These plans lowered premiums but had more cost sharing. That means higher out-of-pocket costs until you hit your annual limit. Then, after that, they cover 100% of cost sharing for Parts A and B. They were designed to help keep premiums low and encourage consumers to manage their healthcare costs wisely. Today, Medigap plans range from Plans A to Plan N. E, H, I, and J plans are no longer sold. Plans M and N were introduced in 2010, and starting in 2020, plans C and F, high deductible F, also are only available to those who are eligible for Medicare before January 1st of 2020. Remember, not every insurance company sells every plan. They get to decide which ones they offer, so you should always shop around. So there you have it. A quick tour of how Medigap plans came to be, how they've evolved over the years, and whether you're new to Medicare or just trying to make sense of your options, knowing the history can really help make informed choices. If you found this video helpful, give it a thumbs up, and don't forget, subscribe for more clear, helpful content on Medicare, insurance, and retirement planning. Got questions? Drop them in the comments below. Thanks.